it also makes me realize that although we embark on something so vocational like dentistry, that doesn't mean that's the only thing that you have to do for the rest of your life.
Nadia, thank you so much for agreeing to be on our podcast here today.
Hi, Chiko.
How are you doing today?
I'm good, thank you. How are you?
I am very, very well, thank you. So we'll just go straight into it, Nadia. Tell me a bit about your background, and also for those people who don't know who you are, tell us a bit about who are you?
Okay, so my name's Nadia. I am currently based in Yorkshire. I am a part-time consultant in orthodontics and part-time in orthodontic specialist practice. In terms of my background, I graduated from Sheffield University in 2007. And after that, I moved around the North and the Midlands quite a bit for various different hospital jobs. So I did my VT year in Nottingham, and then I did senior house officer jobs in maxillofacial surgery in West Yorkshire and then in Birmingham. I spent 1 year in Manchester at the dental hospital doing pediatric dentistry, orthodontics, oral surgery, radiology. And then I embarked upon my journey to do orthodontic training. And then, I finished my training for years, 2016, 5 years ago. And then I spent 2 years in orthodontic practice, and I returned to do the next part of my training to be a consultant in Birmingham, which I completed at the start of this year.
Fantastic. Quite a lot of achievements there in your experience, which is really good. So if we just take you back a little bit, I normally start these like this. Tell us a bit about your background, where you're from, what was your childhood like?
Okay, so I was born and bred in Yorkshire. I'm a proud Yorkshire girl. In terms of what my childhood was like, so I'm the youngest of three, and there's quite an age difference between me and my brother and sister. So they pretty much got packed off to uni when I was in primary school. So much of my childhood was spent, I guess, enjoying time with my school friends and doing quite arty, crafty things. And I think that's where my creative side and my creative hobbies have continued still, because I think that's how I used to enjoy some of my time as a child. Enjoyed quite a bit of traveling, spent time with family, with my brother and sister, parents, going on holidays quite regularly. So I was quite blessed to have traveled from quite a young age. Again, I think that's where my interest in continuing to pursue adventures and travel continues as well, even now.
Oh, fantastic. And where did dentistry come into all of this? At what point were you thinking, okay, I'm going to be a dentist? Is it what you've always wanted to do?
No, I'd say it wasn't what I always wanted to do. I'm quite fortunate that I was surrounded by a lot of my cousins and siblings who were already in the medical field, some of my uncles and family members as well. So I was inspired at quite a young age to have a drive towards really continuing with education, a lot of value behind pursuing a career and something in the medical field. I think that my initial interest was actually in medicine, but when I did my work experience, which was actually with a consultant in orthodontics, I then developed an interest in that, and I thought that's actually quite fun. It's using my artistic and creative skills more than I think if I'd been a medic. And also I found that it was quite interesting to see the different kinds of patients that were coming into the practice and in the hospital that I was at. So I often forget that my work experience wasn't just in a dental practice. I did actually go to a hospital unit and see a consultant orthodontics, and that's where I am, which is really strange. So I often forget that I did that as part of my work experience. But I think that's where the interest stemmed from then. It was really when I went to watch these people and realized that the work-life balance was something that appealed to me.
Fantastic. And was it, what were you like in school when you were younger? Were you an academic? Were you, very good with your studies and all of that sort of thing? Or was it the other way around?
Yeah, I was very academic. I enjoyed artistic things. So I was pretty good at art and did a fair bit of music. So I was in the choir. We went to the Music for Youth BBC thing that was in London. That was like one of the highlights, I think, when we were in sixth form. But otherwise, yeah, pretty academic. Never liked writing essays, so I hated English and writing essays.
Brilliant. Yeah, no, that's good. And obviously, you've not taken the natural route to dentistry. What made you choose the way you went?
It's a good question. I think that I often wonder, after doing all these years studying and training, Chiko, why didn't I choose to go into practice? Well, I never really liked general dentistry. When I was at uni, it just wasn't something that appealed to me. I really like the surgical side of things, and I always liked being in a big environment. I found the concept of being in a dental practice a bit claustrophobic as well. I have since changed my mind about that when I've worked in some pretty amazing orthodontic practices, and there's a lot of people in there. But I think my VT year didn't really help because it was a very small room, small practice, just not the kind of environment that I think I'm suited to. I'm very much a people's person. I like being around lots of people. So being in a hospital environment always really appealed to me. I think that after I did a placement at the hospital in maxillofacial surgery as a fourth-year student, I actually thought this is what I want to do. And I then pursued the route I took for the first few years to get to a point where I could apply to do medicine after dentistry. So I did my VT year and then 2 years in Max Facs. And at that point, I applied for medicine, and I was told that I would be successful in obtaining a place on the 3-year course at that stage. But I withdrew my UCAS form and thought, I don't think I can do the hours that they do as I'm a lot older. So for that reason, I withdrew my application, even though I knew I'd have a place to do medicine, which would have been for 3 years. And it was one of the hardest decisions I made, because I really, really wanted to do it at that stage. But I thought, I don't want the lifestyle. So for that reason, I then pursued orthodontics, and I went to Manchester for 1 year and really enjoyed it. I had quite a few people there who really inspired me to want to do orthodontics. And then that's why I chose that route.
Fantastic. And obviously you talk about inspiration a lot. Obviously you having that inspiration. What kind of role have these people played in you? Do you think that's been a big part of your career so far, that inspiration from different people along the way in your various different experiences that you've had?
I think there's certainly been a few key figures who did definitely make me want to aspire to follow that route. And I think that there's those who I certainly thought, I don't want to be in that kind of field. So it kind of worked both ways. And having experienced so many different places, I think I counted at one point, I worked in over 15 or 16 hospitals. Yeah, it must be in excess of that, because I've spent that number of years in training and been in a couple of different places within 1 year. So after seeing that many different teams of people and being able to meet such a diverse group and loads of medics and surgeons in the hospitals, I worked in A&E departments, which I absolutely loved. Going to trauma calls in the middle of the night at that time was fun, but I think now I'm glad that I didn't pursue that for the rest of my life. I think that I enjoyed it for a couple of years, but in terms of inspiration, there's so many people along that way.
Fantastic. And obviously you've had various different relationships. I mean, work relationships. I mean, as you've gone about in your career. And obviously one thing that I hear a lot when I go around to speak to different dentists is obviously there's always, not always, but some people seem to have a lot of strenuous relationships between practices and principles and that sort of thing. Like, is there anything that you've encountered? Is there anything that you think, is a solution to some of those issues that people face, when dealing with each other within the dental profession?
Yeah, absolutely. I don't think there's anyone who would say they haven't experienced that as part of their career journey, certainly at the stage that I'm at now. And having been in a lot of big teams with big personalities, absolutely, I have encountered that. And I've overcome it as well. And I think my advice would be to have the support you need in that workplace. And there'll always be someone there, especially if you're at a junior stage, there'll always be someone there to look out for you, or that you should be able to feel you can talk to try and resolve that. And I think now, being on the other side of training and now in a position where I support trainees and teach, etc., I think that I would always say to them that there's always a solution, and you shouldn't have to put up with any kind of difficult relationship in a workplace. Although everybody experiences it, it's about working out a way to make it more tolerable. And I think now, with my hat on as a life coach, which I've recently certified to be, I'd say that there's always something positive that you can also see in that situation. And I'd say, think about the things that you're grateful for in that workplace, and then you can make a decision whether actually it's something that you can't continue to encounter, or if it's something you want to work through and decide to continue there. Because I certainly would say you should never have to encounter anything that is unfair or unjust in a workplace or with difficult people. And sometimes the best thing is to move yourself to the right place if you think that that place isn't going to improve.
You bring us to a very good point when you talk about life coaching. One thing that I've realized, obviously, you've done various different things. Another thing that you've done teaching, you're teaching and you're doing life coaching. And what gave you the confidence to then say, I could be a dentist, I could work in a hospital, I could be a consultant, I can also do life coaching, I can teach. What gave you that confidence to do all of those different things?
That's a very good question, Chiko, because I think that when you're going through it all, often you don't have the confidence at all. When you're continuing to be a trainee for so long, you've graduated at the age of 23, but yet up until last year, I was still always reporting to someone. There was always a senior. And being a trainee when you're still in your 30s is not easy, because in many professions you'd then be at the most senior point. And I think in this path you have to learn to just keep going. I'm not so sure that the confidence always stays. I think there's not been many times where I think that has been there, to be honest, because there's always something that we have to tick off, or another assignment or another exam. So I think that just staying close to my value of working hard and continuing not to give up on any achievement that I had, looking back, I think that that's probably what kept me going, because I don't think it would have been confidence through a lot of that. I think there's always a lot of challenges.
That's a great point, because like, for me it seems like you almost seem to have to enjoy putting yourself in these uncomfortable situations constantly, and I personally believe that's what actually builds confidence, constantly stepping out of your comfort zone. Because one of the things that, obviously, when we met originally, we met on Ashley Latter's course, and you were doing a bit of teaching there as well, and obviously one of the things that we talk about, like in sales, is confidence. And Tell me a little bit about like things like that you've learned to help you cope and build in these uncomfortable positions, because no one likes being in uncomfortable positions. Like, what are some tips? What are some things that you do to still help you keep going in these uncomfortable positions?
I think that the first thing for me is faith. I am very close to my faith, so I think that that's always something that I've put a lot of trust in God throughout difficult situations that I've faced. I think I'm very grateful to have a very good support network and close family members, blessed that my parents and friends and family were there when there were some of the challenges that I faced. I think that my advice would be to think why you are there at that point. What is it that is keeping you there? And what is it you want? And I think you need to reflect. And sometimes challenging situations are always there to test us, and they will build strength and resilience. And at the time, it feels like, why am I in a difficult situation? But in fact, you don't realize how much it is building your resilience to cope with even more in the future or different scenarios that might happen. I think that I'd also say it's important to look at the whole life picture as well. Is it that workplace or work relationship or whatever it is that's causing a challenge? How big a part does that play in your overall life plan? Because often we get so consumed by work. I know I've been there before, and we forget that actually there's a whole lot of other things in our lives that also have to play a more important part. And it's important not to be sucked in by something that is causing some difficulty, when in actual fact, it's a small part of your whole life. And I think that when you're in that situation, it's also important to look back and say, well, what have I overcome already? And there's no reason why I can't overcome this as well, because I've overcome this X, Y, and Z before. And if I'm really true to myself and that I still want to achieve whatever it is that I'm doing, then there's no reason why I can't do that.
Yeah, those are some fantastic points there. Like, it's making me think about my own life and all the different things I've been through. And I loved what you talked about there, looking at your whole life picture, and you talked about knowing what you want. And tell me how's that played out for you a bit in your life, like in terms of, how have you kind of got to a point where you know what you want? Because obviously, even to have done all the different things that you have won, you must have an aim of where you want to get to. So talk to me a bit about that kind of idea of the full life picture, knowing what you want and kind of going for it.
So I think that once I'd made my decision that I wanted to get to the position of being a consultant, I guess that was my career goal, which I'm very grateful that I've now achieved. I think that also I've realized through the other interests that I've developed over the past few years, after a particularly difficult time a few years ago, I did embark on a journey of learning more about self-development and all of the kind of things around that. And I think that that's when I started to see what benefit a coach can have towards somebody. And through those that I met, I realized that I had such an interest in that a few months ago, when the opportunity came to train as a coach, I thought, oh, well, just out of interest, that's something that I want to do. And in actual fact, I never realized how natural it came to me and how much I had an interest in that. And it also makes me realize that although we embark on something so vocational like dentistry, that doesn't mean that's the only thing that you have to do for the rest of your life. I think that now I've certified as a coach, I certainly want to take that further. And it feels very uncomfortable to think that I'm going to do something else as well as orthodontics, because we're so conditioned to think we graduated as a dentist, that's what we're going to be. And there's a lot of very talented dentists out there who have a lot of other skills that they could do. And it doesn't mean they're going to leave dentistry, but it might mean that they can also incorporate something else that they're very good at within their working week. And it gives a bit of variety. And it seems really strange for me to even think that that's something that I might now take up, because even I've thought, oh no, that's the only thing I can do. I have to be an orthodontist. Well, actually, no, you don't have to just be an orthodontist. You can go do something else as well. I absolutely love cake decorating. I really want to have a cake making business, but it hasn't happened yet because I've been in that situation of, oh well, how am I going to do that? Because I need to do orthodontics all week. Well, that's not actually the case. So I think that my life coach training has put a completely different perspective on things. And in terms of other life goals, I think that personal relationships and family and having time for hobbies, they're all really important. So that's part of my whole life goal. I think that I've got to the career goal that I wanted. And now I've realized there's a lot of other things that are still things that I'd like to do.
Yeah, fantastic. I think you literally just set some dentists free then, because in a sense that I think, you know, you meet a lot of people, and not just dentists, other people who they do one thing, they go to school for one thing, and they always think, I have to just do this now. Almost like sometimes you get to a point where you feel like you could easily get to a point where you feel like I've invested too much into it. I have to go all the way and I can't do anything else, sort of thing. But that's starting to show you that you can do other things, because you're finding a lot of people now that are doing various different things. Dentists that become YouTubers and, you know, all these various different things that, you know, you find that you try it out and you think, you know what, I might actually just, you know, stick to this because it's something that I enjoy. And do you think that, and this is, I don't know, I think it might help, but do you think that it helps sometimes if dentists had other things that they do? Do you think it helps their dentistry in any way, shape, form?
Definitely. I think that we shouldn't just focus everything in one thing, because actually you never know what's going to happen. I think that, in answer to your question, yes, it's important to have other skills. And the reason I say that is because I was faced with a situation 1 year into my orthodontic training where I was in a car accident and I had a wrist issue that just took a long time to settle. And in that time, I didn't know if I could return to dentistry. Not just could I return to orthodontics and to the training, which I'd put so many years into getting a place to do, but could I return to anything within dentistry? Because we think, well, what else is there to do? How else am I meant to continue when I've spent all these years getting to that point? But actually, if there is ever a need to change career direction, it's really not the end of the world. It's redirection. I think it's reframing how we think of something. At that stage, if I hadn't been able to continue, it would have been a redirection. And I looked at what else I was interested in. I thought about going to law school and doing a postgrad course, but I felt so lost because it's assumed that that's what we're going to do for the rest of our lives. That if we don't actually realize the other skills that we have and what else we could do, if there's ever a reason why there isn't a need to have a change, there's no way of managing that.
It's a life coaching session, this is. And so I like the word you used. You said reframing. What does that mean? For those that may not know, for those of us that may not know what that means.
So reframing to me, the definition would be a different way of thinking, a different perspective, a different way to think about a certain situation that you're in. So reframing, for example, reframing how you think about something. Instead of getting up in the morning and saying, oh, it's always miserable and dull in England, it's rubbish weather, get up and think, well, actually, there's variety in our seasons. There's people in other countries who don't have the opportunities that we have. And, you know, you can go into it even more. They don't have water that's going onto their farmland, and we're actually quite fortunate. I'd say it's a different perspective, and it's reframing the way you think of something. So, for example, if a particular job opportunity wasn't working out, rather than thinking it's the end of the world, I would say, well, actually, you've now got an opportunity to go and pursue whatever you want, and you've got a clean slate to work with. And it could be the best thing that's ever happened to you that that job hasn't worked out, or you've not been successful in a particular job interview, because you've now got loads of other opportunities, and you can find something else that might even be better. And I think that's another example of reframing how you think of a certain situation.
Yeah, brilliant, brilliant. And yeah, and I'm sure there's a lot of people that are out there that, have studied for so many years and do want to pursue something different, but they feel like they can't. And even people that may feel like, oh, well, you can only, because obviously you hear about specialism and jack of all trades. And, what are your thoughts about that?
I think that it's always good to maintain your skills in whatever you're doing. Having specialized, it's only natural that I'm going to say that I chose this route so that I could have the opportunity to really focus on this one area. So obviously, I think there's advantages to that. Otherwise, I wouldn't have chosen it. But I think that certainly keeping up skills in lots of different things, there's nothing wrong with that. I think that maintaining your ability to do, for example, lots of different types of dentistry is a great thing. And if you want to choose one thing that you're interested in, that's fine. If you feel that that's not for you and you like the variety of doing everything, that's equally as much as you can have an opportunity doing one thing, you can have a lot of opportunity doing lots of things as well.
Yeah, brilliant, brilliant. And you've obviously achieved, a lot of different things in the years that you've done dentistry and all the various different things that you've done. What would you say you're most proud of? Something that you've achieved up until this point?
I think certainly for me, the thing that stands out is overcoming the injury, returning to training when I was told I might not be able to return. And not only did I return, but I then had to start from the beginning again. And that was a big thing to overcome, to watch not one group of people, two groups of people who started after you go through and they've finished. But actually just gave me even more determination to get through, because I thought if I've overcome that, there's nothing now that I'm going to let me be stopped by to get to the end. And then I think that in that time, it also made me appreciate it way more. I appreciated finishing my training way more than a lot of other people, because I was in a position where it was almost taken away. So I'd say that was the biggest achievement for me, was finishing my training and getting on the specialist list, because that exam was the one that meant a lot.
Mm-hmm. Yeah. No, that's there's a lot there. And what if you had to think back now to that moment when you've had this injury, they've told you that you might not be able to make it and come back again, knowing what you know now, what would you say to yourself if you had to go back to the darkest moment you had in that in that time? What would you say to yourself?
I'd say make the most of whatever time you now have. If you can't do clinical work, to go and pursue something else with that time. So I think that worrying about it continuously consumed me at the time. If I looked back now, I'd say have faith that it will be fine. It is going to heal. It's just taking longer than initially you would have expected. But in actual fact, you've now got all this time where you're not on clinic. Go and do something else with it. And I never did that. It could have been anything. It could have been something more academic within orthodontics, because I did continue with my master's and I did continue with the university side of things. So I was still studying, even though I couldn't go onto clinic and see patients. But there could have been a whole load of other things. I could have learned another language. I could have read some history about something that I'd wanted to know about, or read about anything new. But I didn't do any of that because it was so conditioned to think that that's one thing we have to do, that's all I thought about for the year that I couldn't see patients.
Yeah, brilliant. Look, Nadia, this has been amazing. I've got other questions, and I hope you can come back on soon where we could talk more about other things, as I'm sure many other people have other questions that they would like to ask you about some of the things that we talked about here today. And if people want to, get in touch with you, what's something that you're doing at the moment that you'd like people to know about, and where can they find you? And that's
so my Instagram handle is Nadia Ahmed Orthodontics. The website should be going live hopefully within the next month or so. That's the best way to get in touch. The email address and the website details will be on Instagram very soon. In terms of other things that I'm doing, I'm very much looking into teaching opportunities and teaching orthodontics in different ways. So watch this space for that. And we'll definitely be looking into how to set up the coaching side of things, life coaching and career coaching, which is the particular field of coaching that I am currently exploring to hopefully launch in 2022.
Fantastic. And is that mainly for dentists, the life coach, or is it for pretty much anyone?
No, I think it will be for anyone, Chiko. I think the overall life coaching is the particular part that really interests me. So it would be for absolutely anybody. But obviously, with the background that you now know that I've had and what I can relate to, I think that there will be an interest in coaching for dentists and career coaching within that as well.
Fantastic. Thank you very much for this, Nadia.
Thank you. Thank you so much for giving me this opportunity, Chiko. It was really good to connect and to do the podcast.